I decided that I was going to go out and I wanted to help people that wanted help. And so I just thought, okay, what are all the skills that I have? What else could I do?
Welcome to Nursing Beyond the Bedside. I'm Audrey, your host, and a nurse who pivoted my path several years ago. After 8 years as a critical care nurse, I was ready for change. I craved higher pay and more flexibility, but was struggling to find a clear path forward. Fast forward through positions in recruiting, customer success, and marketing, and many lessons learned along the way. Today, I run Pivot Path, a company dedicated to empowering nurses to redefine their careers. This podcast is designed to help you navigate the journey from clinical bedside nursing to a fulfilling career that aligns with your passions and goals. Here, you'll discover inspiring stories from nurses who've gone beyond the bedside, successfully transitioning to non-clinical roles, or redefining their nursing career. Join us as we hear their stories and share actionable strategies to help you make your own leap. Whether you're a new listener curious about what lies beyond the bedside, or a returning audience member in need of some fresh motivation, this podcast is your go-to resource for exploring new opportunities that can transform your career. Let's get started. I'm excited to welcome Dr. Suzi Waddill-Goad to the show today. Suzi is a distinguished nurse leader with over 30 years of experience in healthcare. She holds a Doctor of Nursing Practice in Executive Leadership, an MBA, and multiple certifications, including Lean Six Sigma Black Belt and a Certified Health Coach. She's held positions ranging from staff nurse to chief nursing officer and has authored 4 books on the topics of nurse burnout and business basics for nurses. In today's episode, Suzi will share insights from her own journey and will dive into the reality of nurse burnout, what it really looks like, how to recognize it in yourself, and practical strategies to overcome it. We'll also explore how nurses can take steps to lead, advocate for change, and start viewing their career as limitless. Suzi, welcome to the show.
Thank you, Audrey. I'm happy to be here with you and all of your listeners.
Yeah, you have had such an interesting and broad-reaching career. And so I'm really excited to share that with our listeners. You have transitioned from clinical nursing to consulting, business leadership. Can you start off by kind of giving us an overview of your career journey and maybe call out some of the pivotal moments that you feel like shaped your path?
Sure. So my very first job in a hospital was when I was only 14. So it was before I actually became a nurse. And so I got to see, firsthand all the things that go on in a hospital, which, solidified my idea of wanting to become a nurse. And then I just spent about 1 year doing med surg and then moved into critical care. So I spent a lot of years in ICU and then the emergency department. And then it was kind of by happenstance. So one of those transitions that you speak of, where it was a time when many patients were being transitioned to managed care. And so virtually overnight, we lost a large number of patients out of the emergency department that I was working in at the time. And so we needed to have a reduction in force, which most people, when they hear that, a RIF, they're going to think of it as a negative thing. But it actually ended up turning out to be a really positive thing for me because I had an opportunity that I hadn't really thought about. And so I moved into being a nursing supervisor at the time. And so that was really interesting. And so I did that probably for a couple of years. And then I got, another tap on the shoulder. And this is another thing that, sometimes people will recognize skills or talent that you have, and they'll ask you, hey, have you ever thought about doing this or that? And so it was one of those experiences where the chief nurse of the hospital that I was at and the chief financial officer wanted to know if I would help them with a project. And I was like, okay, sure. So I started doing a project with order entry. So this was many, many years, prior to having electronic medical records. And that was really interesting. And I enjoyed it, as well as doing my shifts. And so then there was another project that came after that. And they said, do you want to do another project? And I was like, sure. Now this one was redesigned. So it was in the 90s, when all of the, hospitals were getting kind of re-engineered. And so I learned a lot about project management, a lot of different departments in the hospital, which was really interesting. So I got a really broad view across the organization. And so I did that for another couple of years. And then the chief nurse decided she was going to retire at the hospital I was at the time. And so I thought, hey, I bet I could do that too. And so I applied. And so I got my very first job as a chief nurse when I was only 34. Now, the best part about that is I was in business school at the time. And so I was just finishing out my MBA, which was great, education and new skill making for having a job where you were going to be in a leadership role that you had to manage, not just people, but the business side of an organization. And so I did that for a number of years. And then the hospital that I was at got into a bit of trouble. And so we had a pretty much wholesale leadership change. And so that presented another opportunity where I thought, you know what? I think I'm going to start my own company. So now if you fast forward 22 years, that's been 22 years ago, it'll be actually 23 in June, I decided that I was going to go out and I wanted to help people that wanted help. And so I just thought, okay, what are all the skills that I have? What else could I do? And so I started doing initially just operational consulting for hospitals and mostly ones that were in trouble. And then about the second year I was in business, I stumbled on interim leadership. And so I thought, oh, that would be kind of interesting. And so it's been a very nice blend of doing both. So it's been about 50-50, sometimes just straight up consulting, sometimes interim. On occasion, it ends up being both, or, one will lead to another, which has been really good. And so I've had lots of really interesting experiences around the country, meeting lots of great people and doing, what I think is really good work.
It sounds like you have really been, it goes beyond being in the right place at the right time, but there, it does come with like taking that initiative to like take on the next thing and the new opportunity. I think that can sometimes be really hard for nurses to say yes to opportunities like that because they're unfamiliar. Is there anything like that you might be able to pass along that you can share that kind of gave you confidence along the way? Like any learning there that allowed you to like confidently step into these new roles where, it was a new step up and maybe you didn't already know everything that you needed to know and needed to learn to really excel in the role?
Well, I think you just said the perfect word, learn. Because honestly, a lot of times you're right. You don't know everything you need to know to do it. Like I certainly had no idea what I was getting myself into when I, became a chief nurse for the first time. There were many days where I sat in my office thinking, what was I thinking when I decided to do this? But I had lots of colleagues that I could call on, not only nursing colleagues, but other, non-nursing colleagues as well. And so I think that, like I said, opportunities sometimes present themselves where you just have to be willing to take a risk and not be afraid. And like you also said, there's so many opportunities in nursing that, if one doesn't work out, and I always say that, sometimes rejection or when something doesn't go right, it's redirection. And so it's not necessarily a negative thing. It's really how you think about it. And it's the mindset that you bring to, your work and the practice.
Yes, absolutely. And actually, I'm glad that you said that because I think that we get on this podcast a lot and all of these conversations, like myself and the guests are always like, nursing has so many opportunities. But sometimes when you're in it, in like a bedside clinical role, it doesn't always feel that way because you haven't necessarily explored everything that's out there or had your eyes open to everything that you can go and do and like the steps to go and get there. And so a lot of bedside nurses are like kind of have that mindset. I mean, I know I did at a certain point of like, nursing equals working clinically, working with patients, I didn't necessarily see how that translated into things beyond bedside nursing. So have you had any sort of like evolution of your perspective change on like when you first started, like what it meant to be a nurse and what that could mean in your nursing career and kind of how you look at a nursing career and opportunities now?
I think, honestly, now it seems more limitless, if I could use that word, because we've got, so many sick people. We're trying to change the trajectory, of where we're headed with, a sick population, and at least in my opinion, it's like going towards the edge of a cliff because we have, many more people that are sick than we do have caregivers. And so somehow it's like we need to kind of change the trajectory of the Titanic, really. And so I think there's going to be a lot of opportunities for nurses, outside of like acute care where, how do we do things to help people stay well? Besides all of the hospital, the jobs particularly that are in hospitals, because about, I think it's 60% roughly of nurses are employed in acute care. And so if nurses are looking for opportunities, I think one of the best ways if you're in a hospital organization is, and I know this sounds crazy, but look at the phone list. Because honestly, you can see all the different departments in the hospital, and many of them have nurses in more non-traditional roles. So if you think about, how the electronic medical record has evolved, And so there were not nurses in IT. If you think about nurses in, sales, for example, so all the different vendors, that bring us equipment, there are now many opportunities in those organizations as well. All of the ones for like case management, all the clinical specialties, and there's so many. And then all the outpatient, surgery centers that we have now, outpatient imaging where we're doing procedures, that might require nursing expertise. The other kinds of specialty surgery centers like, plastics and all the different things people are doing now. I mean, aesthetics has become like another, area of expertise, and like, permanent makeup and lashes and, all different, so there's lots of choices, I think. And just I think a lot of people feel stressed when they're in an environment that either their capacity has been taxed or they have just decided, they're kind of their intuition is telling them and they've decided that it's time for a change. And so exploring what the options are, I think is healthy, because, it's not necessarily good, I don't think, to stay in the same place. And I've always been a person that's been very open to change, very open to learning. I had and this is going to sound weird, but I had no plan, honestly. I did not, say I'm going to go get this degree and I'm going to do this job and then I'm going to do this and I'm going to do this and I'm going to do this. I didn't have any of that. And I still have never had any of that, even in business, because I've had to, in business, as and I love the name, Pivot Path. I love the name of your company because really, that's what you have to do. Sometimes in business, you might have a plan or you might be doing some research and development and it doesn't work out. And so you have to be able to pivot. And so I think, developing skills that are transferable. And that's, probably another buzzword that you need to, learn things that you can use in other areas.
Yes,
that would be
absolutely.
Useful.
Yep. And I love that you used the word limitless when thinking about a nursing career, because I think that is so true. And I think you hit the nail on the head with like where we are today. Like, I think that it is nursing's like blockbuster moment. Like we can step up, we can have a seat at the table, we can like be involved in like the development of new technology and how that technology is implemented. Like we can help guide the business of healthcare. Like nurses really have so many opportunities. And, you experience this in your own career. And like you also talk about this in your book, Business Basics for Nurses, but you emphasize the need for nurses to understand the business of healthcare to become effective leaders and really drive change. And I think that is kind of a gap that in like the education that we get as nurses, right? At least it wasn't when I was going through school. But like, what do you think are some like practical ways that nurses can like start developing this knowledge, this business knowledge, and like fine tune their leadership skills, even if they're still at the bedside currently?
Well, I think certainly there's many sources, like there's many books, that have been written about business and leadership. You can also do, more and more formal program, for some sort of educational track. And they're so flexible now. When I did, of course, my first nursing degree, which was a very long time ago, it was like boots on the ground. You had to be present. Then when I did my master's, I actually was fortunate that I did sort of a distance learning program is what they called it at the time, where, we sent papers through and, through the snail mail, to my professors. And then, of course, when I did my doctorate, it was more online. But I think there's so many opportunities where if you have a flexible schedule and you're still at the bedside, where you're working, either full-time, part-time, but you have shifts, then you have days when you're off. And so you have, time when you can kind of, figure out with the rest of your life where you can fit time in to do school. And even like at the doctorate level, it was about 10 hours a week. And so if you really look at, and I've encouraged people to do this with their time, to like work, it's called work sampling, but to work, it's an industrial engineering term, but to look at your own schedule and your own life and to figure out, there's 24 hours in a day, 7 days in a week, do the math, and then figure out what you do each day and where you spend your time. And so it will become glaring sometimes. What you're doing is, might be wasting your time. It might not be maximizing your time. You'll figure out you may not be getting enough sleep, that you might be working too much, and so there's some, kind of tips and tricks along the way to sort of figure out, or be more intentional, I think is probably a good word, about what you want to be doing, because sometimes people your life is sort of happenstance, and people do this in jobs too, and particularly in leadership roles. I found there's not good onboarding. Two, there's not necessarily good training about business and, and leadership development per se in organizations. And so I think, being more intentional about how we design leadership rules versus being, leadership by default. So leadership by design versus leadership by default. And so really looking at, what are the important things that we want leaders to do? And what are the things that you don't want leaders to do? I mean, because there really should be a list for each. And are there things you can delegate? Are there things you can just not do? I mean, because that's the other thing, and like I said, I've kind of had a nice mix of doing interim leadership as well as consulting. And so I feel like I've not become a consultant who's just telling people to do things in the environment that's unrealistic. By doing interim leadership, I still have done the jobs. And so, which makes it nice because you don't get disconnected as a consultant where you might be recommending all kinds of things that sound great in theory, but you could never put them into practice. Right. And so I think those are some of the things that come to the top of the mind.
Yeah, absolutely. And, nurses, as far as advocating for change and like seeing problems, even like in the organizations that they're working in now, and then going and like trying to like work with leadership to create solutions to those problems. I think that having that like kind of zoomed out perspective of all of the different like things that go into decisions that are being made, because it's, it's not just nurse staffing. It's not just like what diagnosis this patient is coming to the unit with. It's, it goes like you talk about in your book, like it goes on to like healthcare as a business and a service, and like all of the budgeting, cost effectiveness, and like return on investment that goes into like all of these decisions that are being made. I mean, I think that that's just something that your typical bedside nurse just doesn't have a lot of exposure to that. And then I've also talked to a lot of nurses who become like unit managers and do get a bunch of exposure to that. And they get caught kind of in this tug of war between healthcare administration and like the budgets and the cost effectiveness, and then like what their nurses are wanting and needing on the unit, and trying to like advocate for both, make both sides of the equation happy. But I think that it could maybe change the perspective of how nurses think about like the decisions being made by leadership, or like the things that are kind of happening on their unit, if they have this broader view of like the full context of what's happening from where they stand all the way up.
Well, and I think, one of the things that you have to learn when you move into more leadership roles and more like, as a manager, director, certainly an executive, is you have to be able to make a business case. And I've always said, care takes time, and time is money. I mean, when you're in a business, time is money. And so really trying to look at, what are the things that when we provide care for patients, are there things that make it, more efficient? Are there things where, for example, if nurses aren't hunting for supplies or equipment, all of those things waste time when you could be doing something much more meaningful, like at the bedside. And so it's like, if you look back at a lot of the hospitals went through, lean processes in the early, 2000s or kind of mid 2000s to kind of mid 2010s. And so really looking at, where are things located? How do we get supplies? How much time does it take to do anything specific? Not only care tasks, but, documentation and, all the different things that go into caring for a patient. And so, I've always been able to, effectively make a business case with a return on investment if you look at, those kinds of things, and to be able to put it in there, strategically where, and you might need something for safety, or you might need something to improve quality, but you have to be able to build a case that you can sell to people that don't necessarily have the same expertise that we do. And so, like the care takes time and time is money is a nice equation because, you could basically put that into, a business case kind of format, and I also say that a lot of it starts with it used to be the power of the pen. Now it's the power of the click, because the providers order the care that takes the time that equates to the money, and so are we also schooling the providers, on things like, okay, do we need to have patients have lab work every X amount of hours, or could it be once a day, or so thinking about, how we judiciously use the precious resources that we have in a more efficient way and still effective, not necessarily to do anything detrimental to patient care, but to make sure that we're using them in the most efficient way.
If a nurse is listening to this conversation today and they're thinking like, man, I would love to advocate for a different procedure or workflow or something that I see can be more efficient on my unit, what do you think is a practical way that a nurse can like start advocating for that change with where they are now?
Well, I think, there's no substitute for, I would say, picture's worth 1,000 words. And so, a lot of times you can draw how things work now, and Lean has many tools, for value stream mapping. And so there's different kinds of tools for flows charts, which is really simple and really easy to learn. But, just write the steps of how something is done and write the steps of how something could be done. And then I also think, all of the workarounds, because, nurses, we are masters at making things work.
Yes.
And so if plan A doesn't work, we always have a plan B. If that
or
doesn't
we
work,
can
we have
make
a
one
plan
up on
C.
the spot.
Yeah, exactly. We rarely give up. Exactly. When a patient needs something or we need something. And so we're pretty resourceful. And so I think, documenting some of those things too, because, a lot of these things that we do that are workarounds to get what we need, then if you don't kind of send that up the flagpole, like, we don't have enough linen, so we go take it from this location. Well, we might not know that taking it from that location has a whole bunch of downstream effects. And so I think it's that, that you have to think about, when we make a change or we do a workaround, what are the consequences? And then are they worse than the workaround? So that's the kind of thing about workarounds, because some people think they're very negative, but, not necessarily. It depends on the circumstances.
Yeah, that's a good call out, because I think that if you're the nurse in that situation, like creating the workaround on the fly, you're not thinking about like what those downstream consequences are going to be. Like you're thinking about like satisfying the need or that you or your patient have in the moment. So yeah, again, I think just having that like zoomed out perspective is a big takeaway from all of this whole conversation.
It does help sometimes you just step back.
Yes, absolutely. And while we're on the topic of just kind of like creating change and advocating for change in the workplace, like you also in your Beyond Burnout book, like you talk some about how nurses can, like, if leadership can give them an opportunity to feel valued and like really like create real change, that can help address nurse burnout. And I think that I hear from a lot of nurses in their jobs, they're just like, I don't have a voice or no one's listening to me. It's really hard to create any meaningful change. If there are nurse leaders listening today and they're like, okay, I feel like this is maybe a way that I can like help with the morale and retention on my unit is by like giving nurses more opportunity to make real impact and let their voices be heard. How can nurse leaders start to do that for their staff?
I have some good ideas about that. So I'm thinking particularly about a nurse leader role that I had in a very large hospital system, running a very large emergency department that was doubling in size right when COVID became a thing. And so, it was really important at that time. And it's still, it's not that it's not important now, but to listen to what everyone had to say. And so I worked with the nurse managers that were in the department, and I was actually the nurse director at that time, and talked about, okay, we need to take all the feedback that we can get from people and have some way to document it. And so we actually created a spreadsheet that had all the information and the feedback we were given, basically what the status of it was. And, I'm a big fan of action plans. So if you get information or you have a meeting, what's the follow-up, by who, by when, and then you track these things. Because if you don't track anything, you can't measure it. And you certainly can't say that anything ever got done. And so I think, that's been one of the most effective ways that I've found is to be able to have some sort of tracking mechanism and then actually share it with the people who brought the ideas forward. Where are we with that? Or is it in progress? Is it something we absolutely can't do right now, but we're going to like put it on our capital list, or do we have to put it in the parking lot? Or are we going to be able to resolve it by, next week? And so I think that, that goes back to how important communication is, and that really it's a two-way street, and that you don't want people to feel like they're bringing information forward and it just goes into a black hole.
Right.
And so I think engagement is the, the buzzword of the week, because I know lots of people are doing their culture of safety and their, engagement surveys at this time of year. But, part of that is really the closing the loop on that. So if you're listening to what people are saying, then there has to be an action plan from the leadership, and it has to be communicated back, like, what is our plan? I've also posted things like in public places like the break room, the bathroom, and kind of what the status is of that sheet. And I'll never forget that it was, I've had many experiences, along the way doing these interim assignments, but I've had staff come and say things like, oh, you actually do what you say, which I thought was really interesting and kind of enlightening. Or they say, when we bring something to you, you actually get back to us.
Yep.
And I thought, well, yeah. And I mean, and for me, that's normal. And I'm thinking, well, isn't that how it's supposed to work? I mean,
it
that's
is.
the thing. You have to follow up. I mean, it's no different than as a nurse. If you delegate a task and you don't go find out, what happened and did it actually get done, then you don't close the loop. And so it's no different like with leadership. It's just totally in a little bit different way.
I think that is so important because so often as a bedside nurse, I feel like we're just like screaming into a void. Like we say like, these are problems, this, needs to happen, whatever. And it's just like poof, like out of your mouth and into the black hole, never to be seen again. So I think that is such a huge takeaway for nurse leaders is closing that loop. And, you're right. Like that is fundamental to that closed loop communication is fundamental to how we communicate as nurses. Like to your point, if you delegate something, if you ask the CNA to go get vitals, you want to know what those vitals are. If you're like running a code and somebody pushes, a dose of atropine, like you need to confirm that it was pushed and what the dose was. Like we are taught that as in nursing school, we know the importance of that closed loop communication. So, I think that calling out that shouldn't disappear when it gets to leadership is a great takeaway.
I also have another idea. One something I've done at almost every interim assignment I've ever done is I've posted, those big sheets of paper that look like a sticky note, but they're like 3 feet, 3 feet long and a couple feet wide. I've actually posted those in the break rooms and said, if you were me, what do you think I should spend my time doing as a leader? And it's pretty interesting what people write, which either tells you that they do have a good idea of what your role is, or they don't. Like they don't know like what you're supposed to be doing. And so it's either a top opportunity, to educate people about, okay, this is what we're supposed to be doing. And these are all the things that we have to do in our job. Or, okay, this is great. Now I know what your priorities are so that I can help make, my priorities be aligned with your priorities and your boss's priorities and their boss's boss and all of that, but it's a good opportunity to kind of get a status on where people are with what they think you as the leader should be doing.
How often do you find that there's a gap or a misalignment in understanding between the staff and what the leadership role actually is?
Always. Pretty much always. And it's been in some places that it's been kind of nice, where you have a little bit of flexibility in your budget to have some work shadowing, that goes both ways. So either as a leader, go spend a day or more with your staff. And see what goes on in their worlds. I mean, I've done it as a chief nurse too. It's been great. I mean, it scares the daylights out of people usually, when you show up in their work environment and say, hey, I'm going to work with you today. And they're like, what? But it's so enlightening for really both people, that are involved in the process with the patients, and then and same thing for the staff. If they could come, with you for a day, as a leader and see what your day entails. I mean, it's very eye-opening.
How do you think we close that gap a little bit and let staff get more of a well-rounded understanding of what leadership is actually spending their days doing?
Yeah, well, I think a lot of it is communication. I mean, and knowing, because if you don't communicate as a leader, where the department of people that you're leading, if they don't know what your priorities are, they can't help you. And so I think, it's important to know that, these are like the priorities for our department, or our division or our hospital, if you're depending on what level that you're at, but that's so everybody's on the same page and can do their part, so kind of painting a picture, letting people know what their part is in that picture and feeling the engagement piece of it, at the end of the day to get a certain outcome. I mean, so it's no different than, outcomes for patients when we have a care plan. And we, figure out all the things that we're going to do for the patient so they can meet all these outcomes. And so on this schedule, so they can be discharged, and so it's really the same in leadership where you have, all these different things that you need to do that need to be done by all these different times, on for these different reasons, and that yield some sort of outcome. And so it might be a business outcome that's, related to safety. It might be security. It might be regulatory. It could be business. It could be quality. It could be related to money. It could be, and so it's the same sort of thinking. It's just a different set of content, I guess, if you could call it that.
Yeah. Again, goes back to that closed loop communication, making sure that everybody is like kind of on the same page. Like on that note, I kind of want to switch a little bit to talking more about like nurse burnout. And a lot of nurses, unfortunately, feel like nurse burnout is part of the job, right? And you kind of challenge that in your book, Beyond Burnout. How can nurses start to shift their mindset from burnout being an inevitable part of the job to something that can be managed or prevented?
And I want to preface what I'm going to say by, I wrote the first book about nurse burnout that you can see here behind me. It got published in January of 2016. So that means I started writing it in 2014. And so this has been a decade long, of talking really about nurse burnout. And so I think at the time I was starting to wave the white flag that, we're headed in the wrong direction. So I think, there's many things that you can do as a nurse yourself. And I think one of the most important things is to know yourself and know your limitations. And they might be limitations based on, how many hours you can actually work. Knowing your limits when you get tired, because we know that tired people, or if you have, inattention, you make mistakes and, just based on human error. And so there are things that we can, and I always talk about systems and error proofing. And so can you error proof yourself as well? And things like, making sure that you do, drink enough water, that you eat, a clean diet, that you get enough sleep. And so I think, a lot of it goes back to, what are your own limitations and what are your own boundaries for your own life? And, work, I always tell people, is one part of your life. And you don't want to wake up one day and realize that that's all you did.
Right.
And that it took up more of your time than it should have, or too much of your time, and that you missed important events, either with your family or doing other things that you weren't able to do. And so I think that, it starts with knowing yourself. I think it starts with, really knowing what you want from your career and from your job, and what does it require of you? And are you willing to make that sacrifice? And that's specifically different when you're working shifts, when you move into a leadership role where it becomes more like 24/7, and what are you willing to give up to do that? And there are some people, I could tell you many nurse leaders I know have decided it wasn't for them. Just because you jump over the fence, it doesn't mean you can't either jump back or you can go in a different direction, because a lot of jobs are about fit and about culture and about finding the right environment that, meets your values, that you like the people that you work with, and that you are, able to feel like you're making a difference and that you really have purpose. And so I think, evaluating those things helps to prevent getting burned out.
Yes. And I think is an essential step if you're considering a career change too. Like, and you kind of alluded to this earlier, saying that like, people get in a hurry, like life just kind of like happens, but that causes a lot of people to just kind of like go through life without ever actually like pausing and doing that self-reflection that you're talking about and thinking like, okay, what do I value? Like, what are my priorities? Like, what's most important to me? Because I also feel like nursing is such a giving, we're a caretaking profession that we pour so much of ourselves into that, which isn't necessarily a bad thing. But I think that if you're not careful to assess like how much of yourself you are really willing to give and what that is going to pull away from other things that you value and prioritize, you can find yourself in a bit of a sticky situation. And so I think that that is a huge lesson there. It's just like, take a step back. What's important? And things shift too, like what you value right now and like what you're prioritizing for this chapter in your life might change in the next chapter. And like, I think that that's totally okay and natural. So I think that that kind of cyclical, like reassessment of like, okay, where am I? What's important to me? What am I looking to optimize for right now? And like, where does my career fit into that is really essential.
Yeah, I call those kind of the seasons of life. And you're right. Especially as you grow older, your priorities change.
Mm-hmm.
And that's okay. And do you need to compare yourself to all your peers? No, you don't.
Mm-hmm.
You're your own person. And you can embrace individuality, and you don't have to go with the flow. I mean, and I've probably have gone against the grain more in my career than ever going with the flow. And it's worked out fine. Yeah.
Yeah, absolutely. And, you write some about like professional integrity and how nurses sometimes feel pressured to overextend themselves. And that can lead to burnout and some moral distress. Can you talk some about the connection between professional integrity and burnout and how nurses can like advocate for themselves and for what they value without feeling any like guilt along with that?
I think that it goes back to like a couple of things I said. One, your mindset, about your work.
Mm-hmm.
And either you have most people either have a growth mindset or a fixed mindset. And a growth mindset is more open to, change, possibilities. It's a different kind of thinking. And it's different than the negative kind of thinking that we're trained in. So if you think about how we learn to be a nurse, most everything is process of elimination. And my husband tells me I am an expert at finding things that are wrong, like everywhere. Well, because that's the way that we're trained. And so if you start thinking about, it's a different way to think and to think about, and sometimes as a leader, I've had to kind of shift my perspective and think, okay, I'm going to go walking around today and I'm going to look for everything that's going right. And so sometimes it's hard for us to like change our mindset about all the things every single day that go right. And there's, this many things that go wrong, this many things that go right. And so I think, that's one of the things is mindset. I think the other thing is going back to knowing yourself and back to the, always doing the right thing. And sometimes that may not lead you where you want it to go, but you can live with yourself and, your own values. And so I think, some of that and helps with, like, say, for example, you're in a situation where you've brought something to people's attention and you don't feel like you're getting anywhere, then maybe it's time for a change. So either, that might not be the job fit for you. It might not be the organization for you. I mean, and there are some instances and some situations where, and I think this is particularly in the places where healthcare has changed so much in the last probably couple of decades, but certainly in the last decade, and you've had private equity enter healthcare, which is a completely different way to do business. And so I think that's some of the moral distress, and some of the, we want to do the best things for the patients that we can, but we have new and different limitations. And so, how do you do that and try to balance, cost, quality, and service all at the same time? And so, and it could be quite challenging, all of those things at the same time. And so I think that's, some of it. And, and I think as far as like the finding your fit, it may be, just a different place in healthcare, like maybe not in that same, department, same specialty, same where you can use your skills, but you don't feel that, it's impacting you in a negative way, where you still feel like you have good purpose and that you're feeling like you're making a difference. And so I think that's, some of it, because I think, like we've talked a little bit about boundaries. And then I think the other thing that we haven't talked a lot about in healthcare is hardiness, and just being able to build hardiness and knowing that there's going to be challenging circumstances and situations, every single day, and that you have to have some ability to be able to cope with it. And do we teach people enough about that? I don't think so in nursing school, because I think a lot of people, go into it thinking it's going to be one thing, and then they actually get into the practice environment and it's a completely different thing. And, we've seen lots of turnover in recent years in the first year, with nurses in the first year. Why is that? I mean, I think as leaders, we have to look ourselves in the mirror and say, why is that? What is happening in the environment that's not embracing, new talent and kind of bringing people along?
Mm-hmm. Yeah. And I think that, a lot of nurses, especially burnt out nurses, get caught in that negative mindset that you mentioned, of seeing everything around them that's wrong and totally missing the like positive that's happening.
And it's hard, like I said, it goes against our grain of how we're training to look for what's right, because we're so focused on looking for what's not the norm and what isn't right when we're taking care of patients. And so I've done things like put 5 pennies in one pocket and had to go around and find 5 good things that are going right today and actually bring that up and then move a penny every time I find something right. I mean, so it's sort of like a new way to think and a new way to train yourself.
Yeah. Yeah. And, you mentioned like that hardiness mentality and just like the need to be resilient, which I think is true. Like it's a work environment that you do need to have some hardiness. Mm-hmm. I think that sometimes nurses can hear like, you need to be hardy, like be more resilient as like dismissive of like whatever their concerns are. But I think to your point, like we need to recognize like the workplace and work environment that we're stepping into and having some resilience, seeing those positives and kind of like changing our own mindset in a way that like we feel kind of empowered to take on the next day rather than just like dismissed.
And learning how to deal with stress, because I think that's the other thing is we don't get a good idea of how much stress there's going to be in the work environment until you're actually in it on your own with yourself. Mm-hmm. And so figuring out how to navigate that sometimes is not that easy. And so, does that mean you need to take a break? You need to go outside and walk around for 5 minutes. You need to go in the bathroom and take some deep breaths. You need to do these things that help, decrease the amount of stress. Like, is it, meditation, exercise. I mean, there's some really good, well-known remedies for stress management. And so, do we teach those to people in a way that they can actually implement them in the environment that they're in? Mm-hmm. And do we allow people to do it?
Well, yeah. And that's what I was going to say. Like, how do you as a leader hear like, okay, like I know that like a break is important. I know mm-hmm. that like maybe my nurse stepping out in the sunshine for 30 minutes is important. Like, how can nurse leaders with the like just thinking about the restrictions that they have as far as like staffing, maybe they don't have a resource nurse to give lunch breaks today or whatever. How can nurse leaders start making real moves to like support those things in the environment that they're working in today?
Well, I think, that's one of the most important things is really looking at what resources do you have and mm-hmm. how do you deploy them the most effectively? And mm-hmm. making sure, I kind of have a hard line about certain things where, people need breaks. I mean, you can't work for 12 hours straight, without having a break. I mean, it's not good for your brain. I mean, there's some really good information coming out about attention and about the lack of being able to be focused, if your brain doesn't have time to take a break, and a lot mm-hmm. of our work is knowledge work. We're knowledge workers. And so, making sure that we have those breaks, making sure that you actually can refuel, whatever that means as far as like, trying to refuel yourself. And so I think, as a nurse leader, it's important to know, I think that really can translate in a negative way to patient outcomes. If we don't design our systems on the front end and get the right resource match.
Mm-hmm. Totally.
And I really take responsibility for that.
Yeah, absolutely. Yeah. I mean, I think that like supporting and implementing these policies that like do support work-life balance, they support, resources on the unit, they support mental health resources for nurses, nurses like need these things in order to like provide the care that the hospital needs and wants them to provide for the patient outcomes that are beneficial to like the business in the long run. So it's definitely all connected. And I'm glad that we touched some like on the leadership. I think that like kind of these practical strategies for nurses that we've talked about include like that self-assessment, that boundary setting, that like learning to say no, which can be really difficult, advocating for yourself in the workplace. And then also I think like a support network, like that community, whether it's like your peers, professional network, like therapy, like whatever it is, can be really beneficial too. And I want to kind of share as well that your Beyond Burnout book also has a workbook for nurses.
Yes. Beyond Burnout workbook. Here's the best part. So the book actually talks about specifically, it might give you content or a chapter about something. And then at the end of the chapter, or throughout the chapter, we put what we call practice pearls. And so they're, like 1 or 2 sentence kind of tips and tricks for how to actually navigate those challenges. But then the best part about this book, the workbook, is we took all the practice pearls and we put them into action steps. And so, like, for example, I'll give you an example. So like in the first chapter where it talks about stress, and just the amount of stress. So here, one of the examples is recognize that the healthcare environment is chaotic, fraught with unpredictability, and can be inherently stressful. So a positive mindset about taking on the challenges of the day is key. Much of our perception is based on past experience and our emotions, and it manifests in how we're feeling and what we're thinking. And so one of the action steps is to challenge yourself to think about how you start your day. So do you start it thinking, oh my gosh, I have to go to work? Or do you think about, oh, I get to go to work today? I mean, so it's just a simple, quick shift in mindset, making a conscious effort to switch to a positive thought, about what might go right today, as opposed to, oh no, what's going to go wrong? Another step is, keeping a log in a journal, just about how you begin your day. And then, when you worked through the day, like thinking about how you were feeling, what kind of things made you feel joy? What kind of things made you feel challenged? And can you build coping strategies for the challenging times? And then how you ended your day. And it also helps you figure out if you have, patterns of behavior or patterns of thoughts that might not be serving you well.
I feel like that might also, like, I'm just thinking about how I might use that in a day. And I feel like it could help me identify if there are certain things that trigger me and to flip into that like negative mindset mode. Like, is there just something that I really don't like,
Right.
that like sets me off down that path? And like, once you can recognize what that thing is, then you can kind of like build up that like resilience to it and like start to think about it differently. But yeah, I think journaling and like jotting things down. And, I talk to a lot of nurses who keep like a gratitude journal just to start the day off every day with like, 5 things you're grateful for, rather than waking up and just thinking about all of any negative that could come your way.
That is a great tool, the gratitude journal, because it forces you to think about what's good as opposed to what's not good. And if you like watch the news, if you have, bad day at work, all of these things are like, I always say they're negative inputs. And so it clogs up your brain, with all these things that might be swirling around that are not so good, which do have physiologic effects, to your body. And so it's important to remember what you put in is what you pretty much get out. And so, if you are thinking negative things, your body's going to have a physiological response to stress.
And it's contagious too. Like, I can recall like the feeling of, walking in the morning and maybe I was having a perfectly fine morning and I, sit down to get report from the nurse who was just like, oh my gosh, everything is a nightmare. Everything's terrible. This is going to suck for you today kind of thing. And it's like, oh man, like I just got completely derailed. So I think that that's important to keep in mind when you're interacting as well.
And you know how they say always one person can make a positive difference or one person can make a negative difference. And that goes without saying, like you said, when you show up at work and you see who you're working with, sometimes people would be like, oh no, it's that charge nurse. Or, oh no, it's, that doctor. Or, oh no, it's that whatever.
Yep. Yeah, exactly. And, kind of to close us out here, like burnout can often push nurses to explore career alternatives, which is not a bad thing, could be a great thing. But like, what advice do you have for a nurse who's like maybe feeling overwhelmed, wondering if they need a career shift, or maybe like they still love nursing and maybe they just need to like change their mindset or like advocate, like work with their leadership to advocate for a healthier environment? Like, what are some like things that might help them differentiate which one of those two it is?
Well, I think, one of the most important things is like taking breaks. I mean, we have vacation for a reason. I would say in the US, we're not as good at using it as many other countries around the world. But, I do some of my best thinking when I'm not trying to think, when things will just come to you, or when you're actually on a trip, you're on vacation, and your perspective completely changes, or you're much more, I think, clear-headed about evaluating your circumstances. And so I would, ask people to not make any snap judgments or snap decisions, especially when you're in the moment of it. And I kind of liken, if you're feeling burned out, it's like standing in the middle of a tornado. And sometimes you just have to step out of it and just watch all the stuff swirl, around you, and just step out. And that way you get a different perspective, and so just taking time to, process through, your feelings and your thinking. And, there's many tools where you can assess your values. You can write down lists of what's important to you. You can make lists of goals, so there's lots of, either online, or we have many tools that we've recommended in both of the books, especially the new books, Beyond Burnout. Some you have to pay for, some you don't, but all are very valuable about exploring a lot of those, points where you may have a transition, I would say. That could either be positive or negative, and they helps you get perspective.
Yes, I think that is golden advice to kind of like step away. Don't make any snap judgments when you're feeling like overwhelmed, or, just give yourself that moment to find some clarity. To connect with Suzi after today's show, you can find her on LinkedIn, email her at suzi@suziinc.com, or visit her website that's linked in the show notes below. Thanks for tuning in. Don't forget to hit subscribe to keep up with our latest episodes. And if you were inspired by today's conversation, I hope you'll share this episode with someone who'd love it just as much as you did. If you're ready to pivot your path, sign up for my free newsletter at mypivotpath.com. Get non-bedside jobs delivered to your inbox every week. And if you have questions or just want to say hi, feel free to email me at audrey@mypivotpath.com. Thanks for listening, and until next time.